to invite Professor Fernando, Chairperson of the Centenary Celebrations Committee, to present a memento to the session chair as a heartfelt token of our appreciation for guiding and moderating this session. To our distinguished dignitaries for your presence and participation. You may now kindly take your seats as we proceed with the next item on the program. Transition to a panel discussion titled Medical Ethics, Professionalism and Regulatory Challenges. And it is with great honor that I invite Dr. Suresh Shanmuganathan, who is a senior lecturer and head of the Department of Oral and Maxillofacial Surgery at the Faculty of Dental Sciences, University of Sri Jawaharlal. He is the country counselor for the International Association of Oral and Maxillofacial Surgeons and the Asian Association of Oral and Maxillofacial Surgeons. He is also a council member of the Sri Lanka Medical Council and the Private Health Services Regulatory Council, and a member of the Medical Devices Committee of the National Medicines Regulatory Authority. Ladies and gentlemen, please join me in extending a warm and respectful welcome to Dr. Suresh Shanmuganathan as he comes forward to assume his role as moderator for this session.
Thank you very much. We had two excellent plenary sessions. Now we come into the panel discussion. So we need some time to have some discussions to cut down the introduction, keep it sweet, short and sweet. So these are panel discussions are basically on building trust between regulators, clinicians and the public. And the first speaker today will be Prof. Anoja Fernando. She is the Emeritus Professor of Pharmacology from Faculty of Medicine, University of Ruhuna. And she will be speaking to us on navigating ethical complexities in modern medicine. Over to Prof. Anoja.
Thank you, Dr. Suresh Shanmuganathan, President and members of the Sri Lanka Medical Council, distinguished invitees, ladies and gentlemen. I would like to thank the Centenary Celebrations Committee for inviting me to make a presentation today at the academic sessions. It is a privilege to have this opportunity to be a part of the Centenary celebration. I offer my congratulations to the Excellency for its role in maintaining the high standards of medical education in our country, for which I think Sri Lanka is fairly well known and recognized. I also extend my best wishes to the Sri Lanka Medical Council for the next 100 years. As mentioned, I don't know if it was mentioned, but I was a member of the council for several years, and I remember those years well, when I used to be the only member not required to wear a tie. How do I define modern? How new should the medical procedure or discovery or innovation be to be called modern? And it is difficult to know exactly where to begin. So I thought I would begin at the point when medical ethics was more or less forced to become modern as a result not only of scientific and technological advances in medicine, but also due to the social, cultural and political changes that took place around the world in the middle of the previous century. we look at the evolution of Western medical ethics over the years, we obviously start with Hippocratic medical ethics, which included the ethical principles of beneficence, non-maleficence, confidentiality, and competence. I think some of them were explained very clearly by President Council, Santa Colagoda. Now, the ethical principle of respect for life was emphasized in that abortion was prohibited and euthanasia was also prohibited to physicians. To quote from the oath of Hippocrates, this is the part that says that, I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. In purity and holiness, I will guard my life and my art. Now, so these two, prohibition of abortion and euthanasia, emphasizes moral attitude that was prevalent at that time, and that is sanctity of life, inviolability of life. And this later associated with religions, where sentient life was considered to be sacred and inherently valuable and deserving of protection. In Christianity, human life was valued above all other living beings because humans were said to be created in the image of God. While it was permissible to kill animals, killing humans was forbidden, which is a sort of an anthropocentric view. In some Eastern religions, such as Buddhism and Jainism, all living beings were held sacred, and the practice of ahimsa, or non-harm, was extended to animals as well, which is a more ecocentric worldview based on coexistence with other living beings. This principle of sanctity of life lies at the heart of future debates over abortion and euthanasia. The scientific and technological advances in modern medicine, together with several significant historical events that took place in the mid-20th century, such as the Second World War and its aftermath, led to ethical challenges that transformed medical ethics into the newer field of bioethics. Now here, ethical principles and values that existed for hundreds of years from the time of Hippocrates were challenged by issues such as dramatic improvements in intensive care and life support systems, the discovery of high-tech drugs, vaccines, which kept patients alive indefinitely, and demands for legalizing abortion, organ transplantation, assisted reproductive technology, and widespread engagement in research on humans. To expand a little bit more on these, some of these challenges, for example, medical experimentation. Huge spending on research by pharma companies and research institutions led to conflicts of interest and also caused harm to research participants. Then there was the blatantly unethical medical research conducted without informed consent, such as the Tuskegee study in the United States and the experiments carried out by Nazi Germany during the Second World War. There's also the expense of high-tech vaccines and drugs, newer drugs, antibiotics, which would have led to, the expense would have led to inequity. They may not have been easily available to all the people in the country. They wouldn't have been able to afford it. Then the newer procedures like hemodialysis, intensive care, and so on, again would have been very expensive at the beginning, and again would not have been easily available to all the people in the country. Organ transplantation, some would have led to a situation where the demand was more than the supply, and that has led, as we know, to unethical practices, which has even resulted in stealing of organs from people in other countries and buying organs from poor people in other countries, and many unethical procedures like that. End of life issues are also very important, and they have given rise to a large number of ethical challenges, as you all know. There's no time to go into details of all that. DNR orders, termination of life support, and so on. So all these, I'll come to DNA and ART a little later. But in addition to these scientific and technological advances, there were, as I said, also political, social, and cultural factors. For example, the rise of feminism, which led to demands for abortion. Then, of course, there were the protests against discrimination and inequity in certain political systems in certain countries, such as segregation, apartheid, and demand for independence from colonized countries, mostly Asian and African, and also limited resources for provision of adequate health care. And also, these are just a few of the issues that would have added to these ethical challenges. To go back to the genetic revolution, now it's important when we talk about, this is of course not new, but whenever a new discovery or innovation or issue comes up, we should learn how to identify the ethical issues in that area. So just to briefly tell you sort of what are the main ethical issues that arise from the genetic revolution. Expense, that the increasing use of genetic tests and the expense of it. And is it really useful? Are we just doing tests for research purposes? Are they useful for the parents? Sometimes they may not be able to afford these very expensive tests. And are we doing proper genetic counseling? And we have to remember that they also have a right not to know. They don't always have to know. They may not want to know that they may get Huntington's chorea, and when they are 50 years old, they would much rather live happily without having that knowledge, and so on. So we have to identify these ethical issues in these newer technologies. And if I go on to some of the ethical issues in assisted reproductive technologies, these also have been here with us for some time. They are not all that modern. Donor anonymity versus right to know. When they first started donating their meat, donors were kept anonymous, but now everybody wants to know, so they go around trying to find out who their father is, which can lead to a lot of problems. So these are, without going into too many details, these are some of the ethical issues in assisted reproductive surrogacy. Surrogacy also has given rise to a lot of ethical issues, because you know it's not available in all countries. So if it is not available in your own country, they go to another country where it can be done. For example, an Australian couple went to Thailand, and the Thai woman was expecting twins, but one of the twins unfortunately turned out to be a Down syndrome baby and was rejected by the couple who wanted. So the Thai mother had to look after this baby. So things like that can lead to a lot of problems. The mothers who are, of course, doing it for payment, but yet they are very vulnerable in this situation. And there are lots of other things like the age and so on, who should have it, sort of things, and so on, who should pay. And of course, I think somebody else is going to talk about regulation. But countries like India and Thailand, they are very worried about this. And India, for example, passed regulation. For example, they are very clear who can rent an Indian womb, rent a womb. So they are very specific who other sort of people can actually rent an Indian womb to have a surrogate. So to get back to this slide, To navigate these ethical challenges, new concepts such as autonomy, which I think also in concept of informed consent, justice and equity were introduced into these as new ethical principles. As I said before, these are mainly after the Second World War with the introduction of the Universal Declaration of Human Rights. And also animal ethics and environmental ethics were also introduced into bioethics, so that it's a much wider field which includes medical ethics as well. However, it appears that respect for life itself may have been minimized or got a little bit less, because now we no longer have abortion being prohibited. It's legal in many countries, and also euthanasia is also being legalized more and more in more countries. UK, for example, have just started their debate on that, I think, and also in Canada, Montreal. So, national and international ethical guidelines. So these are some of the modern bioethical. With each new innovation or discovery or technological advance, we have to think of new ethical principles. COVID pandemic, for example, made us realize the importance of public health ethics and these important ethical principles of non-discrimination, non-stigmatization, cultural diversity, pluralism, solidarity and cooperation, production of vaccines, sharing of research results, and so on, social responsibility and so on. All these we think of, not that pandemics are sort of a modern thing, we have had them long ago, but the response to the pandemic, I think, was in a slightly different way because we had all these facilities. So, we do have international ethics guidelines such as the World Medical Association, Declaration of Geneva, and Declaration of Helsinki for research ethics, and UNESCO has produced several international declarations on bioethics. Oops, sorry, I'm going that way. Now, I am not going to talk about AI or the newer technologies or robotics or anything like that. I think there is no time for that. But new millennium, modern medicine has even become more complex. And data banks, biobanks, digitization of medicine, use of big data, all these present ethical challenges. So how do we navigate all this? Well, we can follow a sort of a certain pattern, basic pattern, just the way that we tackle research ethics, which we have done fairly well, I think, because research has to be done by everybody, and it has to be published in international journals, so everybody is very careful about doing it ethically. So just the way that we tackle the research ethics, we can tackle any new innovation or discovery or technology that comes in. So we have to first understand this modern technology or discovery or whatever, understand it properly, educate the health professionals about it. The most important thing is to identify the ethical issues, and here we must identify these ethical issues which is relevant to our own country. We can't just follow what other Western countries are doing, for example, because culturally we may have slightly different views on, say, autonomy, for example. So we have to pay attention to the feelings and thinking of our own people when we deliberate on these issues. But the main thing is, once you identify the ethical issues and once you go on to practice this so-called practice or use this so-called innovation or discovery, we have to try and maximize the benefits and minimize the harm, just as we do for research ethics. Then are there guidelines available? Regulations are not available very easily, but guidelines usually are. If they are not available, then we should develop them so that we can use them. Then follow the guidelines. If there are no ethics committees at the moment dealing with that particular subject, then we should establish ethics committees to monitor how we are carrying out this new thing. Train the members of the committees, not only the people who are doing this technology, but also members of these ethics committees should be trained. And very important, we should educate the public, because they should, I think this is something that we don't do very well in Sri Lanka. I don't think they know very much about any of these things. So I think there should be some mechanism where our people are educated about these things. And it's really important, because we should be able to empower them to recognize their rights and exercise their autonomy when they are faced with all these complex choices that are available in modern medicine and healthcare. Maybe stop here and take part in the discussion with patients. Thank you.
Thank you.